Our first workshop this evening is called COVID Vaccine, Leading with Equity and Building Trust with Facts. It will be presented by Dr. David Baker and nurse practitioner Yolanda Enrich with Novant Health. Please go ahead.
Good evening. Thank you so much for having us. It's a pleasure to be with all of you. I hope everyone's doing well tonight and can benefit a little bit from what we have to share. I'm a family doctor in Charlotte. I practice at our Michael Jordan Clinic on Statesville Avenue. We have a fully bilingual clinic and are happy to serve Spanish-speaking patients. Yolanda also, she works as a nurse practitioner in Winston-Salem and also has a clinic serving Spanish-speaking patients as well. And we would love to take care of anyone in need of a doctor in our two areas. Yolanda, do you want to say hey or introduce yourself?
Absolutely. So thank you for having us here today. We're happy that we're able to share this information with all of you. And like Dr. Baker said, I am a nurse practitioner. I work in Winston-Salem, and we also try to serve the Hispanic community. We have a fully bilingual staff, and we would be happy to have you at our clinic.
So the purpose of the presentation tonight is primarily to share information about the safety of the 3 available COVID vaccines, as well as some of the steps that Novant has taken to distribute the vaccines. I will say that even since this presentation was made, we have been fortunate to have so much vaccine available that vaccines should be readily available for you in many different locations in your community. While we would love to have you as a Novant patient, the most important thing is that you find care that is convenient to you. So with that said, we will get started. The first slide here is a long list of names that makes up the North Carolina COVID Vaccine Advisory Committee. The purpose of this is to show you that many people were involved in bringing the vaccine to North Carolina residents safely. At Novant, we exist to improve the health of our communities one person at a time. And as we continue to work through this pandemic, we have a commitment to the safety of our team members and our patients, as well as the overall health and safety of our communities.
Okay, so a common question that we get is this vaccine safe for me? Meaning like for Hispanics, for women, for men. And yes, this vaccine is definitely safe for everyone. I know there has been mistrust within the medical community from certain marginalized populations that have also been very affected by the coronavirus. But what we want you to know is that we are here to save lives. We don't want to cause any harm. So we're not trying to deceive anyone. We're not trying to discriminate against anyone. The science shows that these vaccines are safe and effective for everyone in the community for which they have been approved. So you can feel pretty safe and confident that you will be okay.
So now we can move on to talk about some of the basic facts that we know about these vaccines. Yolanda, do you want to speak a little bit about the vaccines that are available?
Sure. So we have 3 vaccines that are available: Pfizer, Moderna, and the last one to come out was Johnson & Johnson. All 3 of them are pretty safe. Pfizer can be used in younger populations. Moderna is a 2-dose vaccine as well as Pfizer. And then we have Johnson & Johnson, which is a 1-dose vaccine, which has been really helpful. There are some patients out there that don't like shots, so that's a good option. Also, I have patients that have to travel out of state for work or are not able to make it back for that 2nd dose. So that is a very reasonable vaccine for some people and very helpful to have around. We do hear a lot that the vaccine was rushed. And in a way it was, but because it was a global emergency, meaning the entire world had this coronavirus crisis. So everybody participated to develop this vaccine, and they were created using prior research, testing, and knowledge that had been going on for several years.
to build upon that, the process was quick, but it was quick because an incredible, almost miraculous amount of scientific collaboration went on. But even after that immense effort went in, we still didn't take anything for granted or assume that these vaccines would be safe or effective. That's where the Food and Drug Administration plays its role. They're the organization in charge of making sure that all the medications and food that we consume are safe for our use. They put together committees to review all of the safety data, all of the clinical trials that were done, and look at the effectiveness as well as any side effects and determine whether this is appropriate to give to the general public. And the overwhelming opinion from the Food and Drug Administration was that these vaccines were safe and effective, and it was appropriate to deliver them to the community.
So when they were researching these vaccines and developing them, these companies recruited volunteers from different ethnical and racial groups to make sure that this vaccine is safe across all groups. So if you can see there in this slide, Pfizer and Moderna had about 70,000 participants, and you can see that they included white people, Hispanics, African Americans, Asians, and other races. And then Johnson & Johnson vaccine had about 43,000 volunteers, also including different ethnic groups. And this vaccine was also trialed in other countries like the US, South Africa, Brazil, Peru, Mexico, and other countries. And that vaccine included about 45% of Hispanics in the research.
So the vaccines, with all of the testing that was done and everything we know, what we've found is that they are very safe. And what this means is that the only individuals who should not get the vaccine are those who have had a history of severe allergic reaction to prior vaccines. There are not concerns for pregnant or lactating women or women who wish to get pregnant. Many people will come to me concerned that their diabetes or their blood pressure or their weight or their heart attack or their stroke means that they shouldn't get the COVID vaccines. And the case is actually that those people are some of the ones that need this vaccine most, because those other conditions put you at so much higher a risk of death or severe COVID disease if you were to contract coronavirus. And so it's actually those people who we want to be vaccinated the very most. And I understand the concern and the fear that my medical condition might make me unable to get to the vaccine, but that is actually very rarely the case. Almost everyone can get these vaccines. So we talk about vaccines a whole lot. We throw around these words, and sometimes we forget that we're doctors or medical professionals who went to school for years and years and have learned this language, and then we try to have other people understand it without any explanation. So I wanted to speak for just a minute about how these vaccines work. And what you need to know first is sort of how the body fights infections. So when our immune system, our body is exposed to a virus or any other germ, we have cells inside of us called our immune system that fight back. Those cells, one of the things they do, they make proteins. Those are called antibodies. The antibodies learn exactly what the virus looks like, and they are like specialized weapons to fight the specific virus. Once we have a germ, once we get sick with a virus and we make antibodies, our body keeps that. Our immune system remembers for almost the rest of our life what that virus looked like, so that if we ever encounter it again, we're ready to fight it off. Vaccines, they imitate an infection. They try to make our body develop that memory without actually getting us sick. So when we take the vaccine and we give it to a patient, we are not infecting a patient, but instead we're giving it a blueprint. We're giving your body a way to make antibodies, make weapons against the virus, so that if you do come into contact with it, you can fight it off without getting sick. If there are more questions about that afterwards, we'll be happy to go into more detail in the question and answer.
So some other things that it's important to know about the vaccine is that some vaccines, or 2 of them specifically, need a second dose. That is the Pfizer and Moderna. How that works is when you go to your appointment and get your first one, they will schedule your second appointment there. And you're not considered fully immunized unless you have had the 2 doses. So if you're scheduled to receive a vaccine, Pfizer or Moderna, that needs a second dose, you do need to return for that second injection. Another thing is that there are no major effects expected. We have expected side effects from the vaccine. So you will have a sore arm where they injected you. You may have some pain in the arm. We have had some patients that experience some headache, some body aches, maybe even a fever. But overall, those can be either managed just with time, or you can even use some Tylenol or ibuprofen if needed. Then it is very important to know that the vaccine cannot give you COVID. So you are not going to get COVID from getting the vaccine. Now, if you go and get your vaccine and that same day, for whatever reason, you are exposed to somebody with COVID and you happen to get COVID, you got COVID from that exposure to the person that had it, not because of the vaccine. And then it is important to know that the vaccine is free. So there's no cost associated to it. It's available in almost everywhere. At first it wasn't, but now you can get it everywhere. You don't need to show IDs. Sometimes they may just ask for an ID to be able to spell your name, because it makes it a little bit easier, but you don't really need any documentation to get that vaccine, which I have heard some of my patients, they're worried about that, and that's why they're not getting the vaccine. And then the other thing is that getting vaccinated protects you, but it protects others, and it helps slow down the spread of this disease. So it is really important that you get vaccinated.
Throughout this pandemic, we have been constantly working and adapting and problem solving to try and figure out how to keep our community and our patients safe. I can't tell you how excited those of us in the medical field felt when we knew a vaccine was about to be available. And there are some pictures here of different team members rolling up their sleeves and getting their shot. I remember almost crying after my first dose back in January, because for almost a year we had been with this fear of being infected, this fear of getting sick at work. And to know that soon that worry would be gone was almost too much to deal with. It was overwhelming. And I've enjoyed seeing, as friends and family have gotten vaccinated, seeing the relief that they also have felt after getting their vaccines. Just a reminder, Yolanda mentioned this, that you do still need to take measures to protect yourself against COVID-19. If you have had 1 dose, you are not fully protected until 2 weeks after your 2nd dose. I've had friends and colleagues who got sick between their first and second dose. So it is still very important to do all of the things that we know work so well, including wearing masks, keeping distance from other people, and making sure you're washing your hands regularly. I would also like to emphasize that with all the different information about COVID-19 and vaccines out in the community, it's important to turn to trusted sources, to news outlets, to the medical field or medical community for answers, because many of the things that are on social media, much of the false information could actually lead to harm and make you more vulnerable. So please protect yourself in that way as well.
So I also wanted to let you know that here at Novant Health, we're trying to have everyone to make information available for everyone so they can make informed decisions for themselves and their families. And that's why we have the website getvaccinated.org, or we have pontelavacuna.org. So those are websites where you can go and read all of this information. You can sign up for a MyChart account, but you don't need that to be able to schedule your vaccine. But we also have other resources, like Dr. Baker said, not everything that you see on the internet or in social media is accurate. So websites that you can go is the North Carolina Department of Health and Human Services, your local public health department, the Centers for Disease Control and Prevention, and of course, with your PCP or your doctor's office, they will be able to give you accurate and reliable information.
Thank you for having us. We would love to take any questions or comments from the audience. I believe there are a couple of them in the chat, and then if other people have questions, we can facilitate that as well. One question I see here is asking for a copy of the presentation. That's something that we can forward on to the organizers have. You're welcome to share them with all the attendees. Much of that information can also be found on Novant's website, the getvaccinated.org or the pontelavacuna.org, to find much of those same graphics, same information that we shared. The second question is, what is the probability for kids ages 12 and under to get the vaccine? It is coming, but unfortunately, it will likely still be many months. There are vaccine trials in process right now on children less than 12 years, but they are still ongoing. So they have not yet reached the stage of reviewing that evidence and approving the vaccines for children under 12. The steps you can take to protect younger children: continue to have them wear masks if they're indoors around other unvaccinated people. And also, the more adults and adolescents, the more people over 12 years old that get vaccinated, the less COVID there will be in the community, and the lower the chance that our children will get infected.
There is another question, and it's related to if someone has been diagnosed with COVID, can they also get the vaccine?
Yes, you absolutely should. We know that a past infection with COVID does provide some amount of protection, but it is not 100%. We have certainly seen people who were infected with COVID last spring have repeat infections. We also don't know how long the protection that you get from an infection, we don't know how long that lasts. And there is not a harm to having the vaccine after you've had the infection. So there is many reasons to get it and none to avoid it.
Yes, thank you. As a follow-up question, how long do they need to wait to get the vaccine after they've been diagnosed?
Yolanda, what have y'all been telling people?
So if they're not symptomatic, we're saying about 2 weeks, 14 days after the infection. And then if they're still having symptoms, we're recommending, at least until symptoms resolve.
That's consistent with what we're saying as well. I will say that some people have what we call long COVID. That means symptoms that are lasting for months after their infection. We've seen many, many different symptoms affecting all parts of the body coming from COVID. And there are not big studies to prove this, but there is some evidence that people with long COVID will improve or can have an improvement in their symptoms after getting the vaccine. So I'd recommend it for those people as well.
Thank you. There is a question in the chat saying, when will we need to get a booster?
So I think it is very likely that a booster will be coming. Nothing has been announced about when that will be. Every single vaccine maker is also making boosters. The purpose of that is that the more times your body encounters either the virus or the blueprint for the virus, which is the vaccine, the stronger your immune system is. And so a booster is what can help us make sure that we're protected for many years going forward.
Thank you. At this time, I would like to ask the audience if you would like to ask any question to Dr. Baker or nurse practitioner Yolanda to do so. You can do so directly if you want to. Just open your mic and ask the question.
Looks like we have another one in the chat. If a mom gets vaccinated, can she pass the COVID antibodies to her baby through nursing? I can speak theoretically about that. Yolanda, are you familiar with data or evidence surrounding that?
I've just seen that there's research studies on breastfeeding after receiving the COVID vaccine.
Yeah. In almost all infections and vaccines, we highly encourage breastfeeding because antibodies, protective cells, or proteins do pass through breast milk. And it seems that that does happen with COVID as well. I have not seen big studies showing how much protection a baby would get from the antibodies in breast milk, but it would be more than if they did not have any. So it's certainly a positive thing.
Dr. Baker, you mentioned that people who have severe allergies reactions in the past, they're not candidates for the vaccine. Could you please elaborate a little bit about that and talk to us about what specific reaction or allergic reaction are you talking about?
Sure. So this is specifically if after getting a vaccine in the past, a person has had a severe anaphylaxis or a severe allergic reaction, which means they needed to go to the hospital. They needed to have injectable medicine, like an injection to reverse problems breathing or a drop in their blood pressure. That is what we consider a severe reaction that would make us not want to give you the vaccine. If you think you maybe have had some other response to another vaccine in the past, that would be something to talk with your doctor about, because it's very likely that it would still be safe for you to get the COVID vaccine.
Very good, thank you. We have another question in the chat. After we get vaccinated, for how long are we protected?
So recently, there have been some studies that are still studying it, but it seems that so far, the people that were in the first trials still have antibodies, and that's why the boosters are still on the research, and the data hasn't fully come out, but Dr. Baker was saying likely there will be a booster in the future.
Wonderful. Okay, thank you very much. It's the last call for any more questions.
like I've got one saying, do we still feel confident in the Johnson & Johnson vaccine? And I imagine the person asking that question probably is basing that in the reports of blood clots with Johnson & Johnson as one of the rare side effects. And the answer is yes, we do still feel confident in Johnson & Johnson. The blood clot issue is serious. However, we know that one of the things that a COVID-19 infection does is it makes you more likely to have blood clots. That's why many people who get COVID-19 infections will suffer strokes or at least be at risk of stroke. Because of that, it seems that some of the vaccines, very rarely, the body's response can also produce a blood clot. The cases that were identified were 6 or 7 cases out of 80 or 90 million doses that had been given. And so the possibility, the chance was less than 1 in a million. The risk of blood clot with a COVID infection is much higher than that. And also the risk of other things in life, like getting injured or dying in a car accident, is higher than that as well. So it's something to keep in mind, but it certainly, for me, is not a reason to avoid the vaccine.
Well, thank you. Thank you very much, Dr. Baker and Yolanda and Rich. We really appreciate your being here with us, sharing such a great information. It's so important information for all of us. We appreciate your time and thank you very much for your participation, and we will see you soon.
Absolutely. It's a pleasure to be here.
Thank you so much.
Thank you.